Nandito naman tayo ngayon sa klase natin. It's all about module on week 6, AIDS. Our topic is AIDS, or Acquired Immunodeficiency Syndrome. So, what is the implication of AIDS pala sa social reality in social work, since it is a social problem? Okay, so AIDS have become quite known through scientific publication and to the mass media. This is a current issue which calls for immediate attention of any person who is an authority and understand about AIDS. Undeniably, it is dreaded disease, a social problem to any country. So it has been spread since before. So ano ba yung meaning and nature of AIDS? So AIDS, which means acquired immune or oftentimes immunodeficiency syndrome, is a viral disease. It's a virus that destroys the body's ability to resist infection. So, sinisira yung immune system ng isang tao. It is characterized by severe loss of one's natural immunity against disease, leaving the individual vulnerable to illness that might not otherwise be a threat. Okay, so pinapatay yung immune system ng isang tao. Oftentimes, wala nang depensa yung isang tao para sa mga sakit. The Weekend magazine of the Sunday Express, March 16, 1986, carried reports that in the Philippines, the first Filipino victim came from the United States and died immediately. And the second one left before the Filipino population was even aware he was here at all. A third one diagnosed and confirmed both in Germany and in the Philippines is at large, threatening each and every one of us, male and female, married or single, adult, or child, gay or straight, celibate, monogamous, or otherwise, for AIDS does not discriminate and spare one. Spare no one. At this writing, by the way, Health Secretary Tan, in his statement to the Philippine Star, June 16, 1995, said that for every confirmed HIV or full-blown AIDS case, estimate of 100 other Filipinos similarly affected remained unreported. They are at large, and they know who they are. So, oftentimes pala, alam na ng mga taong to na may sakit sila. But they are not reporting it. And I don't know why. He said further that most of these anonymous victims become two high-risk groups, such as homosexuals, polygamous or yung maraming asawa, heterosexuals, and intravenous drugs users. So, intravenous drugs users, sila yung mga, oftentimes yung drugs nila, injection. So, intra means entering the veins. Okay, yung ini-enter talaga sa veins na yung drugs, ini-inject nila. That's high risk. In another publication, the Today's newspaper, dated August 25, 1995, carried reports that 8 male adults were found positive for the AIDS causing human immunodeficiency virus, HIV. The Department of Health reported in HIV/AIDS registry for a month of July. So, 3 of the victims infected have fully developed into AIDS. So, oftentimes kasi HIV pa lang siya. Okay, hindi pa siya naging AIDS talaga. So, yung HIV kasi, it's a virus, but oftentimes, hindi pa siya nag-full-blown to AIDS. Yung AIDS kasi, yun yung part na nag-destroy na yung yung immune system mo. Yung AIDS pa lang, it's already the presence. It becomes AIDS na once it is destroying your immune system. 3 of victims infected fully developed AIDS. The new figures brought a cumulative total 659 persons who have been identified as HIV infected since the first AIDS case was publicly known in the Philippines. At least 212 are AIDS cases and 104 of them have died. The new record cases are males, age 24. Ito yung mga edad kasagaran. All of them have recorded sexual intercourse as the mode of transmission. So, sabi nga dito, sexual intercourse or sex, the most common mode of transmission of HIV, has infected an estimate of 60,000 Filipinos who are not aware of their medical status, the Health Department revealed. AIDS virus actually attacks the immune system of the body. Dr. Antonio Novak Feliciano, founder of the American Venereal Disease Association or PHILS, immune system to produce immunity or antibodies, fight against germs, bacteria, virus which enter the body. Now, these cells that the AIDS targets are called the T helper. Okay, T helper cells, and these are the ones that are attacked by the AIDS virus. Once your T helper cells are destroyed, now you have no alarm anymore. So bacteria and virus cannot enter your body freely. Now, AIDS virus incubation period can be as short as 6 months, but often it lasts for 5 years or more, when it means that the disease can be widely spread. Kaysa yun yung pagkalat niya, 5 months lang daw, possibly. It might cause to serious things. Now, let's talk about the origin of AIDS. Saan galing yung AIDS? The scientists are one in their view about where AIDS came from and how it is spread to all populated regions of the world. They are convinced that the virus gained a foothold in Central Africa. Okay? In the area that is now Zaire, formerly Belgian Congo, the first known human case of AIDS occurred. Medicare Bulletin, October 19 to October 1985. In pursuing the mystery of how AIDS started, scientists have focused on the American green monkey. Okay, sa unggoy daw galing. A small animal that carries a virus, now known as HTLV-3 or simian T lymphotrophic virus, so similar to the AIDS virus that theoretically one could have mutated into another form. For some reason, the disease was transmitted to the natives o sa mga tao doon, and it was then transferred to Haitians. Then many of them went to Africa during the International Convention, from Haiti to the US, and now to the Philippines. Yung nangyari. Sources of AIDS and means of transmission. Authorities of AIDS state that the disease is caused by infectious agent or a retrovirus known as HTLV-3, which stands for human T-cell lymphotrophic retrovirus. The name reflects virus propensity for invading and destroying the T helper in the body, T helper, which is healthy people stimulated the immune system to fight disease. The virus which spread the disease is variously called lymphadenopathy, associated virus LAV, or human T-cell lymphotrophic virus HTLV-3. Now, there is no evidence that the AIDS virus designated HTLV-3 is spread by casual contact with either virus or objects they have touched. So, there's no evidence na sa pores lang dadaan through having that object. The virus can be transmitted by the bodily fluid or infected person, oftentimes semen talaga, and blood. Now, sexual intercourse, particularly homosexual, is by far the leading means of transmission. Accordingly, semen is the primary agent of infection, and the virus can be carried into bloodstream through sores and lesions. AIDS virus is present in the AIDS victims' semen, and since 70% of AIDS victims are homosexual, it can be stated that it is because anal intercourse is so traumatic that it can actually tear the walls of the rectum. I think it is so understood, leaving open wounds from which the virus can enter. Weekend Magazine, March 16, 1986. Now, the other group in danger of acquiring the disease are drug users. So, who regularly inject, no, sabi ko nga, intravenous and shared needles. So, sila yung mga intravenous, meaning those drugs na ini-inject nila, they intra to their veins, na direct sa veins nila. Kaya nga, di ba, blood transmission yun, oftentimes yung AIDS din. And share needles. Nag-share sila ng mga karayom sa injection nila. The homophiliacs who regularly receive transfusion of untested blood may also be in danger. So, oftentimes, yung mga blood transfusion talaga, so, delikado siya. Now, evidence of the virus has been detected in saliva rin. Meron din saliva raise the possibility that it can be passed through the fundamental means of human affection. So, ano yan? Kissing, oral genital intercourse, or the like. People who acquired AIDS include those sexually active homosexuals, bisexual men, and multiple partners, maraming partner, o sabi mo na doon, polygamous marriage, hindi pala, polygamous relationships, present or past drug abusers of intravenous drugs, ito talaga mostly, those with hemophiliacs or other coagulation or disorders, heterosexuals contact with some with AIDS, and persons who have had transfusion of blood or blood products. Now, AIDS symptoms. Ano yung mga sintomas ng AIDS? Once a person's T helper cell are destroyed, now he has no alarm system anymore. So, bacteria and virus can enter the body. And when the virus keeps killing the cell, AIDS symptoms will begin to appear. So, early signs of virus assault can include such vaguely flu-like symptoms as night sweats, persistent cough, pag-ubo, lymphadenopathy or swollen lymph glands, persistent fatigue or parang pagod lagi, and loss of weight, fever, diarrhea, shortness of breath, skin rashes, cough, or any symptom which may as well be sign of viral infection. Pneumonia or even cancer. When the symptom began to surface, the AIDS victim or a period of months or at least a year having no way to fight the virus begin to weaken, nag-weak na yung katawan, wala nang fight. The ways to the point of death. So, ano yung effect ng AIDS sa isang tao? Now, health authorities agree that AIDS virus is difficult to detect because by the time AIDS victim develops secondary infections, it has already done its work. Parang huli na. Victims die from another disease. Oftentimes, pag nagsimula na yung infection, so oftentimes, nagkakameron sila ng ubo, sa other sakit nila, namamatay sila sa other sakit. Kung napigilan man yung AIDS, sa other sakit sila namamatay. Sabi nga dito, victims all over the world have been fired their jobs, walang trabaho, evicted their homes, binahan sila sa court, barred from parks, refused service restaurant, and forced into bankruptcy. Kawawa naman. The study conducted by researchers in New York revealed that there were 1,910 causes of tuberculosis. So, ito yun, di ba, cough, oftentimes cough. Kaya nga, in 1985, compared with 1,617, the previous year, tumaas siya. A preliminary study found that 80% of TB victims tested may AIDS 10. So, sa karamihan ng may AIDS, sa karamihan ng mga TB, 80% dyan may AIDS 10. Cabalis writes that certain types of cancer or Kaposis sarcoma or tumor, such as cancer that occurs in the age, he further says that it does not only occur more than frequently, but it behaves aggressively sa may AIDS. Meron pa, Burkitt's lymphoma, a type of cancer, which has previously common of Africa, also affects AIDS patients. A society should be showing compassion to people who are ill is often shunning AIDS patients like lepers. Most AIDS victims have been forsaken by their friends and families as well. So how can we prevent and control AIDS? It is said that a cure is years away. Although World Health Organization is optimistic about the possibility of slowing the spread of AIDS, some of the medical authorities preventive measures of the following. First is screening blood. Na-screen yung blood, mandatory testing talaga in terms of donation of the blood, one of the sources of AIDS infection. The second is educating the public, media and booklets on AIDS, its symptoms and sensible precautions that should be taken to avoid it. Next is alerting the doctors to be looked out of AIDS and making it legally notifiable disease, telling homosexuals to stick one partner and to avoid anal and oral sex. The same advice is being given to prostitutes, both sexes, who are also being at risk some visitors from AIDS in affected countries. Now, heterosexuals are being asked to avoid promiscuity or pagrami ng partner. Intravenous drug abuse, yung mga inject ng drugs, are being warned about sharing needles. Yung mga karayom is dangerous because it causes AIDS carriers. Warning women suffering from AIDS, highly sila sa pregnancy ng baby nila kasi pregnancy is sharing blood and everything to the baby. The World Health Organization warns us to take precautions to avoid spread of AIDS. According to Dr. Mahler, who Director 4 was quoted saying AIDS is knocking unpleasantly on the doors of Asia. There are 36,500 AIDS cases accordingly, December 1986. One of the main programs of World Health Organization in the country is an education drive on AIDS, reading, sex education, or the like. Now, Health Secretary Tan stressed that greater awareness of healthy sexual practices, monogamy, and marital fidelity are still among the best way to prevent. So, one partner lang talaga, monogamous partner, contracting the fatal AIDS. Huwag yung marami. Okay? So, lastly, the Health Department advises the use of condoms for safe sex and avoidance of sexual contact with female and male prostitutes. And perhaps best is not to have sexual relationship with one who is not your husband or wife, as the case may be. How about the treatment of this? Actually, no medicine has yet been discovered to effectively cure AIDS. However, treatment of the disease tested 15 department in the US is showing encouraging ability to control lang spread of the virus. Hindi niya mawawala yung virus, pero pag nandiyan yung virus, ikinokontrol niya. Suicide. Dr. Mitsuya, Japanese researcher at US National Institute of Health in Maryland, says drug prevents the virus from multiplying, but it is not a cure. Mitsuya announced the test results to an intentional conference on AIDS in Nagasaki. Now, the drug azidotimidine, or AZT, is one of the several antiviral drugs being tested for use against AIDS and has been shown to inhibit the growth of AIDS virus. It's TLV3. It has been tested on humans since September last year. And only some of the 15 patients at the NCH complained a minor. Maliit lang daw yung nagreklamo for side effects. This raises hope among experts that if new treatment is given early enough, it might prevent the destruction of the immune system and allow some patients to recover. Recently, studies conducted by Latex Product Unit, Ansel International, have shown that a commonly used spermidal cream kills the AIDS virus. Now, Ansel Regional Director Chris Humphrey told news conference that cream, usually used in condom brand as additionally contraceptive protection, killed on contact the virus causing AIDS. The spermidal cream is the best available protection against AIDS, next to abstinence. Okay, here's the summary. So, AIDS is acquired immunodeficiency syndrome. The scientist virus accordingly it came from Central Africa. And these are the types of certain types of cancer in AIDS: sarcoma, the tumor, or the lymphoma. And oftentimes, let's move on to this another social reality or social problem in connection to social welfare. Homosexuality. So, the type of sexual behavior, homosexuality, which has been with us for a long time and is recurring social issues in homosexuality. It can be found among every class of people, mayaman ka man or mahirap, bata or matanda, such like other sexual behaviors as adultery and fornication. Now, many articles have been published about homosexuals and homosexuality. So, ano yung homosexuals and homosexuality? As it seems that more and more are cropping up today. Apparently, in our society, the two terms, homosexuality, is the activity, while the homosexual is the person doing that activity, okay? Now, what is homosexual? The term is used to refer to a man or a boy who is effeminate, meaning medyo babae yung characteristics. This also includes woman or a girl who has qualities, traits of a man. So, both siya, girl or man. What is homosexuality? It's the generic term used to denote sexual responsiveness to a member of the same sex, although more often used to describe erotic attachment among men. It also technically encompasses female or lesbian relationship. While homosexuality is practiced in a variety of ways, with oral, genital, and mutual masturbation, among the more common practice, I think it's understood, no? There's no need to elaborate those kind of practices. Common practices, it is not the activity itself that earns the label or deviance, but the choice of sexual objects. Now, what are the root causes of homosexuality? Can a homosexual be at his own will and effort eliminate such causes and hence become heterosexual? Can he? These are questions often asked by homosexuals. Homosexuals want to understand themselves better and do something about their homosexuality. It is unfortunate that in some places homosexuals are still misunderstood and generally condemned. Homosexuals used to suffer rejection and humiliation, but today's attitude toward them had begun to change. Change is the only constant. Today's society is becoming more permissive and tolerant, and so they are now coming to open. Gays attribute this, in part, their own increasing assertiveness about their rights and about their pride in their orientation. While some attitude change, however, some forms of prejudice against homosexuals still exist. Example, the AIDS pandemic, kasi there are connection to this, kasi mostly sa lahat ng mga AIDS epidemic in 1980s to which many male homosexuals fell victim may have affected anti-gay prejudice. In many prestigious schools, homosexuality seems to be tolerated. Homosexuals group themselves for psychological support and personal contact. They tend to have their own bars, beauty shops, vocabulary, and norms for acceptable and unacceptable behaviors. Let's talk about origin and nature of homosexuality. With the birth of modern psychiatry, homosexuality has come to view more of sickness than of sin kaysa sa kasalanan. Ideas about origin and nature of homosexuality were once based solely on study of maladjusted psychiatric patients. Theories derived from such research have suggested that disorders in family relationship, oftentimes kung may problema daw sa pamilya yung isang tao, that it's between parent and child, either between mother and son, or between father and son, account for homosexual behavior. The development of adult heterosexuality is a long, complex process. Because of the numerous factors which influence this development, many people fail to achieve normal sexual adjustment, and the result is homosexuality. Oftentimes, pag may problema sa pamilya, example, isa kang lalaki, may problema ka sa ama mo, baka daw malaki yung chance na maging homosexual ka. Kung babae ka naman, may problema ka sa ina mo, kasi na-fixate yung pagmamahal nila dapat sa'yo, hinanap mo yun sa iba, nakatulad mo ng sexual. Yun other theory ng homosexuality. Psychologists cited the following. First is glandular disturbance. On a study of male homosexuals, Mearson and Newstad found a relationship between homosexual behavior and the amount of sex hormones. Sabi nila dito, androgen and estrogen in the blood. However, not all homosexuals exhibit similar disturbances, and individuals have made changes from homosexual behavior to normal heterosexual adjustment without altering glandular imbalance. So, how about genetic causes? Is there any genetic causes? Now, search of understanding has advanced considerably with the release of some new studies that make most of compelling cases states that homosexual orientation is partly genetic. But this viewpoint lacks, kulang siya ng conclusive evidence because some psychologists, it is erroneous to conclude that homosexuals are born this way. Okay? Now, every child has an inherent tendency toward homosexuality or heterosexuality. Either one is developed in the formation of his personality talaga. The nurture part, hindi yung nature pala. You are born male talaga. No genetic. Kasi kung genetic yan, baka yung papa mo rin. Hindi naman siguro yung lolo mo. Okay? Dominant mother, meron ko dito yung idea. Dominant mother and weaker father. Now, when such personalities are paired together, unhealthy situation is intensified. The son cannot look up to his father, become a man, to become a man. Kasi nga baka bulakbol yung ama, palahubog, or palainom. He may then lose respect to his father and his own sex. Baka magkawalan siya ng respect sa father niya as sarili din niya kasi lalaki siya. This is heightened when the dominant mother having strong masculine component in her personality. So, pag nakikita niyo yung mother niya na parang lalaki niya yung mother ko, so okay lang siguro. Okay? And belittles the masculinity of their husband. May mga ganun na pangyayari. Okay? So, ginagaya yan ng anak. Kasi our family is our first school, our first teachers, yung mga parents natin. Now, other idea is overindulgent mother. Her overindulgence leads to the boy to develop strong attachment to his mother, which he is unable to break as he grows older. Like, listen to this. He feels that no girl can measure up to his mother and he does not develop normal heterosexual relationship. I think it is understandable. Another is the cruel detached parents. The cruelty of the father or the mother arouses the child's ill feelings and results to the inability to establish adequate heterosexual relationship, thus leading to the persons to find gratification and acceptance from persons of his own sex. This is further strengthened if the child is strictly forbidden to mix the opposite sex. Ang nangyari dito, pag sobrang cruel yung father, pinagbabawalan ka, oftentimes pag pinagbabawalan ka, ginugusto mo naman. In a discussion of homosexuality, Ethical Challenge author Hbse states that the conclusion of a major study was the male homosexuality would not involve giving a loving, constructive, related father. Oftentimes daw, karamihan sa mga homosexual, sa mga lalaki, wala silang naging relationship sa kanilang father or iba yung ugali ng father nila. Siguro na-relate sila sa mother nila, sobrang love nila, and oftentimes gusto ko yung gender nito sa mother ko kaysa sa father ko. Parang nagsisisi sila na lalaki sila. If either the father or the mother has a passive, detached, hostile relationship, this may result to homosexual behavior. This is because the individual who is in childhood was deprived of affection from the parent of the same sex would in later life crave for affection, of touch, embrace the care upon belonging to his or her sex. Oftentimes, pag naghanap yung batang yan sa relationship ng mother niya or father niya, pag hindi na niya na-fixate, maghanap siya, baga mahanap niya yan sa similar sex niya, which is so dangerous maging homosexual yung isang tao. Overt homosexual naman. Now, the situation at times may present a dilemma to individuals whose homosexuality is at first latent. Under circumstances in which individual has no access to the opposite sex, accidental to pseudo-homosexuality frequently occurs. Overt homosexual is developed. This is found in military. Example, sa military, nalulong masyado sa military school, walang mabugahan ng sexual urge nila. Sa other sex nila, sa similar sex na binubuhos yung sex nila. In 1973, homosexuals was removed from the American Psychiatric Association official list of mental disorders. Sabi na dito, the term was used instead of gender identity disorder siya. No? So, it also emphasizes that there is much evidence of a strong persistence across gender identification. Sabi nga, this in 4. So, too many homosexual is a result of misguided upbringing talaga, oftentimes sa parents or guardian, a detour from a straight path to marital adulthood. May mga example sa case ni Rustom, ikakasal na siya ng Carmina. Nahiwalay sila kasi gay siya. Sa case ni Martin Rivera, he is a gay. To gays, themselves being homosexual is neither a choice nor a disease but an identity, deeply felt as back as memory can reach. The conservative moralist, however, homosexuals is a sin, a willful choice by one, choice talaga siya, by one who is going against the law of the Creator. From the legal point of view in our country, lesbianism and homosexuality is a ground for legal separation. Okay, so according sa law natin, Family Code of the Philippines, kung bakla yung isang tao, okay, it is ground for legal separation. Pwede mong hiwalayan yung asawa mo. Kung nalaman mo siya na hindi siya lalaki or ganun, it is bound for separation. Family Code in 1989. Okay? Family Code of the Philippines. Treatment of homosexuals. Ano yung mga treatment dito? Clinical Professor of Psychiatry Hbse maintains that therapy can halt the development of homosexual pattern during childhood talaga. He concludes that homosexuality is pathological and failure to provide therapeutic services for people who wish to become would grave error. Help can be given to those who really wants to be helped, of course. But generally, it is the active homosexuals, who so-called object homoerotic, who seek it. The sexual inverts are content with what they are. In the treatment, homosexual psychotherapy yung ginagawa oftentimes, which is form of a treatment of psychological means, can be effective only if an individual is strongly motivated to overcome the problem. State that those who are satisfied to live as homosexuals show little response to therapeutic endeavor. Treatment may be effective where the individual has some basic value structure or moral code upon which motivation for change be based. So, meron tayong group therapy din. Oftentimes kasi yung psychotherapy, let's not be confused. Psychotherapy oftentimes is one-on-one or face-to-face talaga. In group, meron din tinatawag na group therapy. Oftentimes, yung tawag dito sa social work is group work para ma-encourage kami, mga kasamahan kang same ng problema na sa'yo, ma-encourage ka, magtulungan kayo. Okay? In the face of psychotherapy, oftentimes, yung method dito ng social work is casework. And group work naman yung tawag dito sa group therapy. As homosexual begins to gain insight and makes progress in individual therapy, the counselor may have him join in a group therapy session. Now, this group session helped the homosexual focus on social and interpersonal relationship. Since homosexual is a person who has difficulty relating to opposite sex, the opportunity to engage in social interaction, next therapy is very valuable sa kanya. Okay? Now, other forms of psychotherapy. Psychoanalysts viewed sexual deviance as, on a whole, more difficult to treat than non-deviant neurotics. Because the deviant symptoms is pleasurable, may pleasure nang nakikita sila dyan, one, and therefore becomes the basis of strong resistance to change. Kaya nga, oftentimes talaga, may mga times na, kasi nagkaka-pleasure sila sa sexual intercourse sila sa other similar sex. So, oftentimes, may mga times para matreat yung homosexuality, pinapakasal sila, bago sila i-treat. Kasi, magkakameron na sila ng other sexual orientation sa other partner, kung babae sila sa lalaki, para magkameron na doon ng pleasure, pwede sila magamot. Kasi kung nandun pa yung pleasure nila sa opposite sex nila, similar sex pala, no, baka hindi nila ipatreat yung homosexuality nila. The sex of the therapist complicates the matter. In addition to psychoanalysts, various types of psychotherapy or hypnotherapy have been used. The result works to lambin and help in the treatment of sexual deviance show a mark of reduction naman towards homosexuality. They use the behavioral modification approach, techniques and deconditioning by aversion, which is a shaping stimulus, which undesirable behavior and systematic desensitization are integrated. Systematic desensitization involves teaching the client to relax in the presence of the object and event cause anxiety. Hypnotherapy. Hypnotherapy is viewed as a process whereby the therapists help people utilize their own mental associations, memories, and life potential to achieve their own therapeutic goals. Hypnotic suggestion can facilitate the utilization of abilities and potentials that already exist within the person but remain unused and underdeveloped because of the lack of training and understanding. Hypnotherapy. Hypnotherapist carefully explores patients' individuality to ascertain what life learnings, experiences, and mental skills are available to deal with the problems. In other words, hypnotherapy is learning process for patients, a procedure of re-educate. Next is self-realization, pinaparealize sa kanya kung ano ba talaga siya. A number of therapists believe that confirmed homosexual ability to accept his homosexuality and learn to become comfortable is a legitimate therapeutic aid. Meron tayong individual counseling therapy, kina-counsel yung isang homosexual. And of course, we have vaccine din that prevents homosexuality. Doctors have developed vaccine they claim will prevent males from becoming homosexuals. So, ano yun mga vaccine dito? After 20 years of research, scientists and physicians are convinced administering testosterone to unborn infants will lessen the chance of boys. Kasi yung testosterone kasi, it's an hormone sa lalaki para ma-induce or ma-increase yung masculinity niya. Iba din yun sa babae. Oftentimes kasi yung mga homosexuals din, nagpipills sila, gumagamit sila ng pills. Well, they are altering their hormones. No? Oftentimes kasi yung pills na yan, lalo na kung pambabae, ina-alter na yung hormones nila. Medical experts feel that the stress women experience during World War II caused a sharp reduction in male hormones levels, which their reputes fetuses were exposed to triggering an increase in homosexuality and is beginning to show the globe. So researchers with Germany, they say they're already experiencing dramatic results using from testosterone. One doctor calls it a miracle drug that caused one day spell the end of the homosexuality. So meron tayong summary dito, homosexual or homosexuality, anong kaibahan nila, ano yung cause, origin, nature, and ano yung treatment ng ganito. Okay?